A female client with Guillain-Barré syndrome has paralysis affecting the respiratory muscles and requires mechanical ventilation. When the client asks the nurse about the paralysis, how should the nurse respond? A. You may have difficulty believing this, but the paralysis caused by this disease is temporary. B. You'll have to accept the fact that you're permanently paralyzed. However, you won't have any sensory loss. C. It must be hard to accept the permanency of your paralysis. D. You'll first regain use of your legs and then your arms. The answer is A. You may have difficulty believing this, but the paralysis caused by this disease is temporary. Adam is a 20-year-old student diagnosed of having obsessive-compulsive behavior. A psychiatrist prescribes clomipramine to treat his condition. Nurse Anna understands the rationale for this treatment is that the clomipramine A. Increases dopamine levels. B. Increases serotonin levels. C. Decreases norepinephrine levels. D. Decreases GABA levels. The answer is B. Increases serotonin levels. Nurse Sarah is developing a care plan for a female client with post-traumatic stress disorder. Which of the following would she do initially? A. Instruct the client to use distraction techniques to cope with flashbacks. B. Encourage the client to put the past in proper perspective. C. Encourage the client to verbalize thoughts and feelings about the trauma. D. Avoid discussing the traumatic event with client. The answer is B. Encourage the client to verbalize thoughts and feelings about the trauma. A group of community nurses sees and plans care for various clients with different types of problems. Which of the following clients would they consider the most vulnerable to post-traumatic stress disorder? A. An 8-year-old boy with asthma who has recently failed a grade in school. B. A 20-year-old college student with DM who experienced date rape. C. A 40-year-old widower who has recently lost his wife to cancer. D. The wife of an individual with a severe substance abuse problem. The answer is a 20-year-old college student with DM who experienced date rape. Which outcome is most appropriate for Francis, who has a dissociative disorder? A. Francis will deal with uncomfortable emotions on a conscious level. B. Francis will modify stress with the use of relaxation techniques. C. Francis will identify his anxiety responses. D. Francis will use problem-solving strategies when feeling stressed. The answer is A. Francis will deal with uncomfortable emotions on a conscious level. The psychiatric nurse uses cognitive behavioral techniques when working with a client who experiences panic attacks. Which of the following techniques are common to this theoretical framework? Select all that apply. A. Administering anti-anxiety medication as prescribed scientific. B. Encouraging the client to restructure thoughts. C. Helping the client to use controlled relaxation breathing. D. Helping the client examine evidence of stressors. E. Questioning the client about early childhood relationships. F. Teaching the client about anxiety and panic. The answers are B. Encouraging the client to restructure thoughts. C. Helping the client to use controlled relaxation breathing. D. Helping the client examine evidence of stressors. F. Teaching the client about anxiety and panic. Marty is pacing and complains of racing thoughts. Nurse Lally asks the client if something upsetting happened, and Marty's response is vague and not focused on the question. Nurse Lally assesses Marty's level of anxiety as A. Mild, increased perceptual ability. B. Moderate, narrowed perceptual ability. C. Severe, decreased perceptual ability. D. Panic. The answer is C. Severe, decreased perceptual ability. Nurse Martha is teaching her students about anxiety medications. She explains that benzodiazepines affect which brain chemical? A. Acetylcholine. B. Gamma-aminobutyric acid, GABA. C. Norepinephrine. D. Serotonin. The answer is B. Gamma-aminobutyric acid, GABA. Nurse Mandy is assessing a client for recent stressful life events. She recognizes that stressful life events are both a. Desirable and growth-promoting. Plus b. Positive and negative. c. Undesirable and harmful. d. Predictable and controllable. The answer is b. Positive and negative. During a community visit, volunteer nurses teach stress management to the participants. The nurses will most likely advocate which belief as a method of coping with stressful life events? A. Avoidance of stress is an important goal for living. B. Control over one's response to stress is possible. C. Most people have no control over their level of stress. D. Significant others are important to provide care and concern. The answer is B. Control over one's response to stress is possible. Genevieve only attends social events when a family member is also present. She exhibits behavior typical of which anxiety disorder? A. Agoraphobia. B. Generalized anxiety disorder. C. Obsessive-compulsive disorder. D. Post-traumatic stress disorder. The answer is A. Agoraphobia. Mr. Johnson is newly admitted to a psychiatric unit because of severe obsessive-compulsive behavior. Which initial response by the nurse would be most therapeutic for him? A. Accepting the client's ritualistic behaviors. B. Challenging the client's need for rituals. C. Expressing concern about the harmfulness of the client's rituals. D. Limiting the client's rituals that are excessive. The answer is A. Accepting the client's ritualistic behaviors. Nurse Vicky is assessing a newly admitted client for symptoms of post-traumatic stress disorder, PTSD. Which symptoms are typically seen with this diagnosis? Select all that apply. A. Anger with numbing of other emotions. B. Exaggerated startle response. C. Feeling that one is having a heart attack, generalized anxiety. D. Frequent thoughts about contamination OCD. E. Frequent nightmares. F. Survivor's guilt. The answers are A. Anger with numbing of other emotions. B. Exaggerated startle response. E. Frequent nightmares. F. Survivor's guilt. Jordan is a client with a fear of air travel. She's being treated in a mental institution for phobic disorder. The treatment method involves systematic desensitization. The nurse would consider the treatment successful if A. Jordan plans a trip requiring air travel. B. Jordan takes a short trip in an airplane. C. Jordan recognizes the unrealistic nature of the fear of riding on airplanes. D. Jordan verbalizes a decreased fear about air travel. The answer is B. Jordan takes a short trip in an airplane. The nurse evaluates the treatment of Mrs. Montez with somatoform disorder as successful if A. Mrs. Montez practices self-medication rather than changing healthcare providers. B. Mrs. Montez recognizes that physical symptoms increase anxiety level. C. Mrs. Montez researches treatment protocols for various illnesses. D. Mrs. Montez verbalizes anxiety directly rather than displacing it. The answer is D. Mrs. Montez verbalizes anxiety directly rather than displacing it. Which of the following attitudes from a nurse would hinder a discussion with an adolescent client about sexuality? A. Accepting, encouraging. B. Matter of fact, encouraging. C. Moralistic. D. Non-judgmental, encouraging. The answer is C. Moralistic. Nina reveals that the boyfriend has been pressuring her to engage in premarital sex. The most therapeutic response by the nurse is A. You shouldn't allow anyone to pressure you into sex. B. It sounds like this problem is related to your paralysis. C. How do you feel about being pressured into sex by your boyfriend? D. I can refer you to a spiritual counselor if you like. The answer is C. How do you feel about being pressured into sex by your boyfriend? Malingering is different from somatoform disorder because the former A. has evidence of an organic basis. B. it is a deliberate effort to handle upsetting events. C. gratification from the environment are obtained. D. stress is expressed through physical symptoms. The answer is B. It is a deliberate effort to handle upsetting events. Unlike psychophysiological disorder, Linda with stress and anxiety may be best managed with A. medical regimen. B. milieu therapy, environment manipulation to become therapeutic. C. stress management techniques. D. psychotherapy. The answer is C. stress management techniques. She says to the nurse who offers her breakfast, to a female with a dead husband, "Oh no, I will wait for my husband. We will eat together." The therapeutic response by the nurse is A. Your husband is dead. Let me serve you your breakfast. Present reality. B. I've told you several times that he is dead. It's time to eat. C. You're going to have to wait a long time. D. What made you say that your husband is alive? The answer is A. Your husband is dead. Let me serve you your breakfast. Present reality.